Aortic aneurysm is an enlarged area in the lower part of the aorta, the major blood vessel that supplies blood to the body. The aorta is about the thickness of a garden hose, and it runs from your heart through the center of your chest and abdomen. A ruptured abdomen aortic aneurysm can cause life-threatening bleeding because the aorta is the main supplier of the body with blood. Depending on the size and rates at which your abdominal aortic aneurysm is growing, treatment may vary for a watchful emergency surgery. So, once an abdominal aortic aneurysm is found, doctors will closely monitor the aneurysm so that the surgery can be planned if it is necessary. So always check for symptoms on time so that you can avoid any kind of emergency. Now, the major symptoms of abdominal aortic aneurysm is a pulsating feeling near the navel. Are you feeling a pulsating feeling near your navel? Or are you feeling a deep, constant pain in your abdomen or on the side of your abdomen? Or do you feel a sharp back pain, a very sharp back pain at your back region? And once you notice these symptoms in your body, this is the best time to see a doctor. Anyone aged 60 and older should avoid the risk factors for developing an abdominal aortic aneurysm. There are a lot of risk factors that always makes this aneurysm to happen faster. There are some factors that is quickening the timing of aneurysm. So it's important you know these are risk factors and avoid them so that you don't extend your aneurysm from rupturing. So these risk factors include smoking, family history of abdominal aortic aneurysm, and such persons should consider a regular screening for conditions because being a male and smoking significantly increases the risk of abdominal aortic aneurysm. And men aged 65 to 75 who have ever smoked cigarette should have one-time screening for abdominal aortic aneurysm using abdominal ultrasound. If you have a family history of abdominal aortic aneurysm, your doctor may recommend an ultrasound exam to screen for the condition. There are no specific screening recommendations for women, and if you're a woman and you feel you need to know the specific recommendation for you, you should ask your doctor if you need to have an ultrasound screening based on the risk factors. These are the major causes of abdominal aortic aneurysm. Number 1 is tobacco use. Cigarette smoking and other form of tobacco use appears to increase your risk of aortic aneurysm. In addition to damaging effects that smoking causes directly to the arteries, smoking contributes to the buildup of fatty plaques in your arteries, medically known as atherosclerosis, and also it can cause you high blood pressure. Smoking can also cause your aneurysm to grow faster by further damaging your aorta and hardening of the arteries. So, atherosclerosis occurs when fat and other substances build up on the lining of your blood vessel, increasing your risk of aneurysm. Also, infections in the aorta, medically known as vasculitis, causes abdominal aortic aneurysm. These infections or inflammations weakens a section of your aorta wall. Aneurysm can develop anywhere along the aorta, but when they occur in the upper part of the aorta, they are called thoracic aortic aneurysm. But if the aneurysm is formed in the lower part of the aorta, it is called the abdominal aortic aneurysm. And there is this study that shows that men develop abdominal aortic aneurysm more than the women. And also, when you look at the family history, sometimes people are also being placed on the mark because of the family history. People who have a family history of abdominal aortic aneurysm are at high risk of having a condition. They tend to develop aneurysm at a younger age, and they are at high risk of ruptured abdominal aortic vessel. Now let's look at the complications in the abdominal aortic aneurysm. Tears in the walls of the aorta, medically known as dissection, are the main complications of the abdominal aortic aneurysm. A ruptured aortic aneurysm can lead to a life-threatening eternal bleeding. In general, the larger the aneurysm, the greater the risk of rupture. Signs and symptoms that your aortic aneurysm has burst include a sudden, intense, persistent abdominal pain. Sudden, intense, persistent abdominal pain. You might feel a sharp back pain that radiates to your back or legs, and you find yourself sweating so much, having clammy necks. You find yourself becoming dizzy, feeling of nausea, and you start vomiting, and your blood pressure goes so low, your pulse race so fast, and you might lose your consciousness, and you notice that you begin to have shortness of breath, and you have a high risk of blood clotting in your abdominal vessels. If a blood clot breaks loose from the inside wall of the aneurysm and blocks a blood vessel elsewhere in your body, it can cause a sharp pain or block the blood flow to the legs, toes, kidney, or abdominal organs. If you think you may have an abdominal aortic aneurysm, or you are worried about your aneurysm risk because of a strong family history, it's highly recommended that you should book an appointment with your family doctor. If your aneurysm is found early, your treatment may be easier and more effective. Since many abdominal aortic aneurysms are found during a routine physical exam or while a doctor is looking for another condition, there are no special preparation necessary. If you are being screened for an aortic aneurysm, your doctor will likely ask you if anyone in your family has ever an aortic aneurysm. So have that information ready, because the appointment can be brief and there's often a lot of ground to cover. It is a good idea to be prepared for your appointment. And I'm going to show you some information to help you get ready for your appointment and what to expect from your doctor. So, what you can do to be aware of any pre-appointment restriction. At the time you make the appointment, be sure to ask if there's anything you need to do in advance, such as restricting your diet. For an ultrasound or echocardiogram, for instance, you may need to fast for a period of time beforehand. Write down any symptoms you are experiencing, including any that may seem unrelated to an abdominal aortic aneurysm. So you are required to write down key personal information, including a family history of heart disease or aneurysm. Make a list of a medication, vitamins, or supplement that you are taking. Now take a family member or a friend alongside with you if possible, because sometimes it can be very difficult to remember all the information provided to you during an appointment. Someone who accompanies you may remember something that you missed or forgot. So be prepared to discuss your diet, exercise habit, tobacco use. If you don't already have or follow a healthy diet, exercise routine, talk to your doctor about your challenges you might be facing in getting started. So be sure to tell your doctor if you're a current or a former smoker. And in this kind of meeting, you are required to write down questions that you ask your doctor. Your time with your doctor is limited, so preparing a list of questions will help you make the most of your time together. Now, take a sheet of paper, take a pamphlet, take a pen, list your questions from most important to the least important in case time runs out. For an abdominal aortic aneurysm, some basic questions to ask your doctors include: you're going to need to ask him, what's the most likely cause of my symptoms? What kind of text will I need? Ask your doctor, what treatments are available and which do you think would be better treatment for me? Ask him, what is appropriate level of physical activity for me? How often do I need to be screened for this aneurysm? Should I tell other family members to be screened for an aneurysm? Ask him, I have other health conditions. How can I best manage these conditions together? Is there generic alternatives to the medicines you're prescribing to me? Are there any brochures or other printed materials that I can take home with me? What website do you recommend visiting for more information? In addition to the questions that you've prepared to ask your doctor, do not hesitate to ask additional questions during your appointment. Your doctor may ask these questions. When did you first notice your symptoms? Do your symptoms come and go, or do you always feel them? How severe are your symptoms? Do you have a family history of aneurysm? Have you ever smoked? Does anything seem to improve your symptoms? What appears to worsen your symptoms? If you were diagnosed with an abdominal aortic aneurysm, you should ask about the size of your aneurysm. Ask him, what is the size of my aneurysm? Because the size matters if you're going to need surgery as fast as possible. So, whether your doctor has noticed any changes and how frequently you should visit your doctors for follow-up appointment, you should ask these questions so that you be guided on what to do next. The text and diagnosis for abdominal aortic aneurysm are often found during an examination for another reason. You might come for something else in the hospital and you're being examined for it, and your doctor will notice that you have an abdominal aortic aneurysm. And this often happens time after time. For example, during a routine exam, your doctor may feel a presenting bulge in your abdomen. Though it is unlikely your doctor will be able to hear signs of aneurysm through a stethoscope. Aortic aneurysm are often found during routine medical tests such as a chest x-ray, ultrasound of the heart, abdomen, sometimes ordered for a different reason. If your doctor suspects that you have an aortic aneurysm, specialized tests can be used to confirm it. So, if for any reason he notices that he's kind of like suspecting you might be having an aneurysm, these texts might be a specific text that you might need to confirm if truly you're having an abdominal aortic aneurysm. Now, one of the texts is abdominal ultrasound. Now, in abdominal ultrasound, during this painless exam, you lie on your back on an examination table, and a small amount of warm gel is applied to your abdomen. The gel helps eliminate the formation of air pockets between your body and the instrument the physician uses to see your aorta, called transducer. Now, the technician presses the transducer against your skin over your abdomen, moving from one area to another. The transducer sends images to a computer screens that the technician monitors to check for a potential aneurysm. Now, another one that is constantly used is computerized tomography CT scan. Is a painless test that can provide your doctor with clear images of your aorta. During a CT scan, you lie on a table inside a donut-shaped machine called a gantry. Detectors inside the gantry measures the radiation that has passed through your body and converts it into electrical signals. A computer gathers these signals and assigns them a color ranging from black to white depending on the signal intensity. The computer then assembles these images and displays them on a computer monitor. Another very important test that you could use to check if you have abdominal aortic aneurysm is the MRI scan, the magnetic resonance imaging scan. It's another painless imaging testing. Most MRI machine contains a large magnetic shape like a donut, like a donut tunnel. You lie on a movable table that slides into the tunnel. The magnetic field aligns atomic particles in some of your cells. When radio waves are broadcast toward these aligned particles, they produce a signal that vary according to the type of tissue they are. Your doctor can use these images to produce the signals to see if you have an aneurysm. And there are special drugs and special treatments that is used to manage and treat abdominal aortic aneurysm. It's responded depending on the size of the aneurysm. Now there are different sizes of aneurysm, and these sizes of aneurysm is the major factor that is checked or responded, especially when you want to do a treatment and drugs for the aneurysm. Now we have a small aneurysm. If you have a small abdominal aortic aneurysm about 1.6 inches or 4 centimeters cm or in diameter or smaller, and you have no symptoms, your doctors may suggest a watch and wait, that is an observation period, rather than surgery. In general, surgery isn't needed for the small aneurysm because the risk of surgery likely outweighs the risk of rupture. You get it? Now, if you choose this approach, your doctor will monitor your aneurysm with a periodic ultrasound, usually every 6 to 12 months, and encourage you to report immediately if you start having abdominal tenderness or back pain or any potential sign of dissection. Now we have the medium aneurysm. Remember, small aneurysm is way little smaller, doesn't even need any surgery, but need constant monitoring to know if there's any change. But in the medium aneurysm, it measures between 1.6 to 2.1 inches. It's clear how the risk of surgery versus waiting stack up in the case of medium-sized abdominal aortic aneurysm. So you will need to discuss the benefit and the risk of waiting versus the surgery and make a decision with your doctor. If you choose watch waiting, you will need to have an ultrasound every 6 to 12 months to monitor your aneurysm. And for the large and fast growing leaking aneurysm, larger than 2.2 inches, the 5.6 cm, or growing rapidly, more than 0.5 cm in 6 months, you will probably need a surgery. In addition, a leaking, tender, or painful aneurysm requires instant treatment. Do you understand? You're going to need instant treatment for a leaking aneurysm. And there are 2 types of surgery for abdominal aortic aneurysm. The first one is open abdominal surgery, and the second one is endovascular surgery. Now, in open abdominal surgery, is used to repair an abdominal aortic aneurysm. The damaged sections of the aorta is removed and replaced with a synthetic tube known as graft, which is sewn into place through an open abdominal approach. With this type of surgery, it will likely take you a month or more to fully recover. So in endovascular surgery, is a less invasive procedure sometimes used to repair an aneurysm. Doctors attach a synthetic graft to the end of a thin tube, medically known as catheter, and is inserted through an artery in your leg and threaded up into your aorta. Then a graft, a woven tube covered by a metal mesh support, is placed at the side of the aneurysm and fastened in place with small hooks or pins. The graft reinforces the weakened sections of the aorta to prevent rupture of the aneurysm. The recovery time for people who have endovascular surgery is shorter than for the people who have open abdominal surgery. However, follow-up appointments are more frequent because endovascular grafts can leak. Follow-up ultrasounds are generally done every 6 months for the first year and then once a year after that. Long-term survival rates are similar for both endovascular surgery and open surgery, and the options for treating of aneurysm will depend on a variety of factors, including location of the aneurysm, your age, kidney functions, and other conditions that may increase your risk of surgery or endovascular repair. These are the lifestyles and the home remedies you can try today to save yourself from abdominal aortic aneurysm. And the best approach to prevent aortic aneurysm is to keep your blood vessel as healthy as possible. That means taking the steps: quit smoking or chewing tobacco, keep your blood pressure under control, get regular exercise, reduce your cholesterol level, reduce fats in your diet. If you have some risk factors for aortic aneurysm, talk to your doctor about it. If you are at risk, your doctor may recommend additional measures including medications to lower your blood pressure and relieve stress on weakened arteries. So, aortic aneurysm is very deceptive because sometimes you might feel the pain and you might be tempted to be, or you might be confused, or you might think that the symptoms you're undergoing, the symptoms you see in your body is from some other things. But you will always be advised, if you are having a persistent pain in your navel, or you're having a sharp pain in your back area, a persistent sharp pain, then you're gonna need to talk to your doctor. If you're having sweatiness, shortness of breath, very low blood pressure, and you're having clamminess, you're gonna need to talk to a doctor for proper examination. You can try some of the various tests, ultrasound, MRI scan, and etc. to check yourself to know if you're okay and ready to go. Alright guys, I will be bringing more of the medical health, medical views, and medical care for you next time in this particular channel, this health channel that is built for you to help you stay in health. And subscribe to this channel. Click on the subscribe button, click on the like button, comment in the comment section box below. Let me know if there's any question, or if there's any sickness you want me to talk about. If there's any medical question you want me to answer, you can go ahead and leave it in the comment box below. I will answer that, and I'll be more than glad to know if there's any sickness you want me to talk about. Thank you so much today for coming and looking at aortic aneurysm, abdominal aortic aneurysm today. We'll be reviewing a lot of sicknesses in the future, and we'll be looking at the key remedy, how to remedy it, the symptoms, the drugs, the solutions, even how to book your appointment with your doctors in the future. Thank you so much. Good having you today. Bye-bye.